As healthcare providers move from paper to electronic health records, they positively impact how their patients experience care. The technology improves communication and how population health is managed.
It's amazing the changes that have taken place. In the paper world, it used to be that I would sit with the paper chart on my lap, hidden from view of the patient, and I'd be writing, scribble, which they have no idea what I'm writing. But now what we've done is we've exposed that medical record so that the patients can see it and be engaged, so that they know exactly what I'm doing, and it becomes part of the visit. And it's very valuable because, for instance, when we get test results back, I can show them, look, here's what your cholesterol's been doing, or here's a graph of what your sugar's been doing, and look what your weight's been doing. And you see how, as your weight's gone down, your sugar's improved and your cholesterol's improved. You can show those kinds of things to them. So actually, you've been doing great with your weight. Patients love the electronic health record. Now, at any time, they can go online and see all of their medical information. They get their test results much faster. So when I get the test result, they get the test result.
Indeed, the effective use of health IT leads to increased patient engagement and satisfaction. In addition, shared access to electronic health data within an organization increases the efficiency and quality of care delivery.
There's a lot of power in having data at the tips of our fingers now, I think, as a physician. Just with my colleagues in the office, other team members, the nurses, the medical assistants, nutritionists, it's so much easier now for us to communicate using the data from the patient's records, from information from consultants. We can basically pass it instantaneously to each other, and it makes the communication among staff, clinical team members, so much faster and so much more seamless.
Electronic health data enables providers to manage preventative care more effectively. By monitoring and maintaining the patient's health, they avoid unnecessary ER visits, hospital admissions, medications, and associated costs.
What's great about EHRs and preventative care, and frankly the insurers and how they've constructed some of the risk contracts, is everybody's aligned now to have great preventative care. The patients want to do well. The insurance plans motivate physicians, particularly in groups like ours, to do well in those outcomes.
Okay, look at Batman. I'm gonna show
Providers can analyze the electronic data to look for trends, commonalities, and risk factors. Data analysis enables early intervention, which improves the health of their patient population.
We really want to be able to start to track health indicators, outcome measures, really looking at what's happening, looking at groups of patients, so for example, what's happening to all of our African American patients, what's happening with all of our folks that live in Leominster compared to our folks that live in Worcester, what happens to people that are on certain medications. There's all kinds of things you can start to think about in terms of managing kind of the quality of what you're doing, interventions that you might be doing.
We've dramatically improved the quality, safety, efficiency of the care that we give to our patients.
The true power of electronic health data is its impact on healthcare. By capturing and leveraging electronic health data, providers can improve patient care, enhance population health, and reduce cost. Contact MeHi for assistance with implementing health IT and using electronic health data to improve patient care.